So cardiovascular research is really focused around the lifespan of an individual and the quality of life that goes along with that. So very early on, the prevention and disease, but then we also focus on intervention when we do have an event or when a disease is recognized or the disease process is diagnosed. So there's prevention, there's intervention, and then there's innovative ways to intervene through maybe less minimally invasive techniques. Maybe that's surgery. Maybe that's some of our stem cell programs. But the idea is to understand the whole cardiovascular picture from a very basic science point of view to a lifestyle point of view to ways we can help introduce new treatments, new therapies.
And this is where I think the whole area of stem cell research is very exciting, that we might be able to make a difference to these patients, so that they don't end up with long-term problems like congestive heart failures and abnormal heart rhythm problems in the future. So I'm very excited to take part in this study. I think it's a great thing for the future, and we are very fortunate enough to have a very good research team with the research coordinators and the basic scientists to help us with this endeavor. And we would eagerly wait for the results of this trial after we enroll the patients in this study. So we are also involved in a lot of other clinical research at Aurora St. Luke's Medical Center. We are looking at newer and better options for opening up blockages in clogged arteries in the leg. We are also involved with replacing heart valves through a catheter technique, which is a minimally invasive technique as an alternative to open surgical approaches. We are also involved with research involving new stent designs, which will help in improving the long-term outcome of patients who have heart problems in this area. We also are involved with other clinical trials looking at newer imaging modalities to give us better pictures of the heart arteries and to understand better the whole process of heart disease.
For the stem cell trials, they're very interesting. The theory is that these stem cells are cells that they're immature cells that can be pushed in any particular direction into a type of cell that may heal, may create an environment for healing, or may become something that they aren't to begin with. Everyone hears about the fetal stem cells, the ethically laden baby stem cells. Well, we don't use those here. All of us adults make stem cells every day in our bone marrow, in our hips primarily. It's where the biggest reserve is. The stem cells that are produced in our hips are the stem cells that can become any one of the different kinds of blood cells in our body. Well, we find that a certain subset of these stem cells, when given the right stimulus, can become perhaps new blood vessels. Can enhance the healing process or the laying down of scar tissue in damaged areas. One of the stem cell studies I run has to do with people who've just had a major heart attack with a large area of damage in the heart, inflamed tissue. Those stem cells, when we inject them near that area, will home in on that inflamed, damaged tissue. And that's where they do their magic, whether they create new blood vessels to create extra healing, or whether they help the body's normal healing process turn around and make that better squeezing muscle to improve the heart function after a heart attack. That's what we're here for, to make things better for the patients.
Because at Aurora St. Luke's Medical Center we have an accredited cell processing facility, we are able to support stem cell research and bring the latest innovative studies to our patients with cardiovascular disease.
My focus and our focus of our lab is to study the effect of aging on heart function, and that involves studies from a molecular and cellular level going all the way to whole organ level in tissue that we obtain from patient, going back to the actual patient specimen that we collect during open heart surgery, and correlating that with imaging such as echocardiogram. And also we are looking at clinical outcome of these patients after different types of interventions. The regenerative medicine program, we are also interested in studying the stem cells from patients with different age groups and with different disease conditions. That involves a program where we isolate cells from the heart, different type of cells. These are beating cells like cardiac myocytes, fibroblasts, which are involved in scar formation. One of the major problems in patients with heart disease is that the repair mechanisms that can replace the damaged muscles are not present normally in these heart. And with the use of some new techniques, we can use these cells which can help regenerate muscle tissue or form new blood vessels or help with the repair process. The tools are here that we can use that technology to help our patients.
It's very fulfilling to work with these patients because they want to be in research. They're looking for some hope to cure their pain. I tell people that we're doing stem cell studies here at Aurora St. Luke's, and they're always surprised that we're doing them here in Milwaukee, because I think a lot of folks don't realize that stem cell studies, you think they're conducted East Coast, West Coast, in the big cities like Chicago, but in fact it's nice that we're able to have these studies done right here in Milwaukee. A person participating in one of our trials, you don't have to travel from one building to another building or one town to another town to participate in research. It's right here. So that makes it very nice if you are participating in a trial.
A major area where we are focusing is the patients who have heart failure, severe angina or severe peripheral vascular disease, that they are at risk of losing the legs. We really feel in those patients the regenerative therapies like stem cell therapies or gene therapy have a very good future role. And we are really at this time at the cutting edge. For example, in the transcatheter valve, we are the leader in the whole Midwest, again because of our commitment to the clinical as well as the research services, and Aurora's commitment to those clinical services to provide cutting edge and the futuristic therapies to the patients where nobody else can offer them those therapies.
So Aurora's, particularly Aurora St. Luke's, has been at the forefront of cardiovascular medicine and all the advances in clinical medicine. What is surprising to most of the folks that don't know Aurora very well is that Aurora has been at the forefront of clinical research for a long time. We have a very broad wealth of patients who need additional therapies that are not available in the general community. And that's what attracts all these companies to Aurora, is that we have the infrastructure, we have the patient base, and we have the clinical expertise.
Fortunate enough to have a very good, strong team approach to research in Aurora St. Luke's. We have basic research which works very closely with the clinical research scientist, and we have also the advantage of a large patient volume in this institution. The clinical coordinators are basically very busy, involved with including the patients in the study, as well as following up these patients on the study. We work together, the surgeons, the interventional cardiologists, the basic scientists, the echocardiographers. We all work together as a team whenever we have any studies which we do here at Aurora St. Luke's. And the team approach is what sets us apart from other institutions in the country, and it's probably the basis and the key to success in doing large-scale multi-center studies in this institution.
Also, we are focusing on discovering a new type of cells where cells are isolated from the heart, and the program that we are building will help use these cells to transform them into cardiomyocytes or new types of therapies.
So if I were to look at next generation medicine as it relates to cardiovascular, I would look at not only the new technologies that are coming out, all the way from digital stethoscopes to telemedicine and remote telemonitoring, remote sensing devices. So patients won't always have to run to a clinic or a hospital, but they'll be able to hold up their cell phone to to an artery or to a heart, and that will record the sounds and deposit them directly into an electronic health record, the medical record. So more continuous, coordinated, longitudinal type care being provided in remote places. I think the other thing that we're going to see is a focus around population health management when it comes to cardiovascular care. So it's not only the individual, but within a population. And understanding within that individual or population the genomic side of what we see with regard to cardiovascular medicine.